recent op-ed in the New York Times with Minneapolis Federal Reserve Bank President Neil Kashkari, in which the two of you called for a strict 6-week lockdown in the US to significantly reduce case transmission. So you've been hinting at this over the last few episodes. What convinced you that this is the strategy that we need to pursue?
Well, first of all, as we track the pandemic around the world and specifically in the United States, it's very clear that we're on very divergent paths. And what I mean by that is if you look at many of the countries that in March and April into early May were literally houses on fire. They dealt with these very extreme major outbreaks, just as with New York and the United States, with some similar situations in Detroit, Chicago, Atlanta, New Orleans, Seattle. And then you look around the world, look at the Asian countries, look at the European countries, look at the Middle East. And one of the things that was common to all those countries that responded and subsequently have done a remarkable job of controlling this virus is in their lockdowns, in this whole issue of trying to shut down the transmission, they were able to drive the virus levels to less than 1 case per 100,000 individuals per day. So if you look at that and look at the countries that in a sense took these huge forest fires of coronavirus, put them out sufficiently that they then only became small brush fires again, that they could largely handle them. And we're going to talk more about that in a moment. So I don't want to give the sense that this is not a problem around the world, but they're in a very different position than we are. On the other hand, as we so well know who have been following this podcast, we too responded with this quote unquote national lockdown, although I would suggest it was probably more of a slowdown in retrospect than a lockdown. And we were at 32,000 cases in April, where in fact, again, everyone realized that this was a very serious situation. We saw the physical distancing occur. We saw businesses shut down. But then by the time mid to late May rolled around, we'd given up. We were tired of this. The pandemic fatigue had set in. Cases were now at 22,000 a day, not 32,000. And we thought that was good enough. And then together with the protests that emerged on Memorial Day, we saw what happened over the summer. We were at 65,000 cases a day just a few weeks ago. And now cases are dropping. As I suggested last week, I think they will continue to drop probably in the low 50s to high 40s for the next few weeks. And then I feel quite certain that post Labor Day, as high schools and colleges, universities all come back together, we're going to see another major forest fire explosion of cases that could far exceed what we've seen in the highest numbers to date. So we kind of have this peak, case drops, a plateau, peak, a little higher in the next one, case drop, plateau. And I think that's what we're going to see with this one. And that's just unsatisfactory, as we know, when you look what we just went through 6 to 8 weeks ago. And already I'm hearing people kind of like, well, we're through this one now, just like we felt in May, we were through what had happened in March and April. And when we look at the impact that this has on our country in terms of not only just the mortality and morbidity, but what it does to so many of our economies at the state and local level, it's substantial. And so I've had the good fortune of working with Neil over the past few months and his excellent team at the Federal Reserve here in Minneapolis. And we decided that really the only way that we're going to get through this until the time a vaccine might be available and have the least impact on health as well as the economy is to actually do a real lockdown, another one, where this time we don't give up. And this time we really look at it. I mean, we had states where 70 to 80% of workers were declared essential workers, when in fact, the best data we have says probably about 35% of them really were. I mean, we just never really locked down like these other countries did. Now, people can say, we can't go through this again. We won't go through this again. And I understand that. Trust me, I get it. I'm not so naive as to think that it's just an easy thing to do. But let's just take a step back and look what the cost will be if we don't. The Federal Reserve Bank has looked at this. If we continue to see these large case numbers increasing, we won't be opening schools and keeping them open. We're going to see major impact on business. We're going to see very high absenteeism, people not being able to come to work, and unemployment is going to increase. And actually, it turns out that we've had this amazing kind of a phenomenon occur where, because we aren't spending money during the pandemic, the savings rate in this country has jumped dramatically from 8 to 20%. And the Federal Reserve Bank has looked at this and said, you know what, we could actually support our recovery payments so that businesses, individuals, cities, states, all could be made whole. And that we could take that money that we have invested in savings in this country and basically borrow on it to pay for all of these people, so that we're not asking anyone to lose a job, not get paid, to have a business that goes under because they can't be supported, and use that as the way to move forward. And if we were able to do that for 6 weeks, we could really drive this virus into the ground if we were able to keep the distancing. Then our job would be, after that, is to manage it like the other countries around the world are, where a combination of testing, some contact tracing, putting your foot on the brake in such a way that you actually put it a little harder when we're starting to see case numbers increase, take it and move it down or move it back up when we see things recovering. And, if you look at what's happening in our country right now, we also have an incredible example of what this means. And it would look no further than what we see in New York. After what happened in March, it was a tragedy. And I want to add that, the early days of the New York experience were really horrible, whether it be in the hospitals and the long-term care facilities, et cetera. But they saw the wisdom of this lockdown and really maintaining it to the point of where they could drive these numbers down. And I just want to point out for you what New York did, because they're an island in this country. If you look at the other 49 states and the District of Columbia, nobody's done this except New York. If you look at the 7-day average for cases that they had in the state of New York on April 10th, when things were kind of a house on fire there, they had 9,877 cases reported that day. 9,877. By June 20th, they had that down to 662 cases a day. By August 10th, they had it down to 651 cases a day. Much lower than even the state of Minnesota's, with a much larger population. If you look at deaths, it's even more dramatic. In the sense, April 10th, they had 921 deaths that day. These are 7-day rolling averages. If you look at June 20th, they had 39 deaths. And if you look at August 10th, they only had 8 deaths in the entire 7-day rolling average. So here they've been flat in cases since June. They surely still have economic issues in places like New York City. I don't want to pretend that it's all perfect and back, but they've done what the rest of the country can do. And so I raise this not because I'm naive and think that everyone here is just going to jump on board and say, oh, we'll go through that again. That's not a problem. And they'll tell me about the mental health challenges and the depression, and I understand all of those. But I can tell you that if we have to go through another 6 to 8 months before we might have a vaccine, and we see these large increasing case numbers, it will be much, much worse. This is the vision of what will be. And I'm proposing, and Neil along with me, a vision of what could be. And I think this is an important thing to consider. Do we take our medicine now? Do we take it later? And again, we still have to invest in the public health system. We're still going to have to get on top of these cases as they occur, even after we do the lockdown. But I believe that we will be in a position, just as many countries around the world have done. And if you want to get a sense of that, I just look at the United States and the comparison to the EU and the United Kingdom together now. If you look at the EU and the United Kingdom together have about 510 million people. The United States has 330 million. So if you look at that, they're about 1.5 times larger than we are. Yet if you look at the number of cases, they've had a total of 1.8 million. We've had 5 million, only about 35% of ours. And death-wise, they basically have had less than 8,000 deaths combined. We've had over 55,000. Now, much of that occurred in the earliest days of the EU challenge. If you actually look at the last 90 days, they have been substantially lower than we have, much lower. If you look at the Asian countries, they've been much lower. And so I really want to come back to that. And the other thing that's most notable is the unemployment rates for both countries dropped substantially into the 20% level back in April. Today, the unemployment rate in the EU is 6.4%. In the United States, it's 10.2%. Economically, they're coming back. And that's where we're going to see the jobs come back. That's where we're going to basically see this improvement. So the people who tell me that this is going to ruin our economy, it's just the opposite. And I'm not an economist. We all know that. But I have the good fortune to serve on this paper with one who really is and who has an incredible team of economists behind him. And so I just put this out here and say, as I've said before on these podcasts, you can pay me now or you'll pay me later phenomena. Either we're going to deal with this now or we're not going to enjoy the kind of things we're seeing happen in other countries around the world, and we're going to have an ongoing unmitigated disaster. Now, that may not be sufficient enough to motivate people to do this, but just remember we had an opportunity. This, I don't think, is probably going to be our last one. I mean, I just can't imagine if we don't do it now, we're not going to do it. And we're just going to basically barrel through what's going to be really, really tough for the next 5, 6, 7 months. And so I'm hoping we can appeal to some reason. I don't think this has to be a national issue. I don't believe we have the national will to do this. But as I gave the example for the state of New York, they've done it. They have done it. I give them great credit for what they've done. They are a model for us. When you would say, I don't want to be a model like New York, well, I'm just taking principle what they've been able to do. And so I'm hoping that this discussion continues. There surely was a lot of discussion in the New York Times. Our op-ed piece was downloaded more than 1 million times over the weekend. And I think people are surely looking at it. And this is not naive again. This is really about what we must do.